SARS-CoV-2 is a member of the coronavirus family, known for the crown-like spikes on their surfaces. This virus can cause COVID-19, a contagious viral infection that primarily affects the throat and lungs. But what exactly happens in the body when one contracts the virus? And what causes pneumonia to develop? Additionally, how does a vaccine work to combat the virus? To understand this, we must first take a closer look at the virus itself. The genetic material of the virus contains the information needed to replicate itself, while a protein shell provides a protective enclosure. As the virus travels between people, an outer envelope allows it to infect cells by merging with the cell's outer membrane. Spikes of protein molecules on the envelope act like a key, allowing the virus to enter and take over the cell's internal machinery to build new viral components. When an infected person talks, coughs, or sneezes, droplets carrying the virus may land in the mouth or nose, eventually making their way to the lungs. Once inside the body, the virus comes into contact with cells in the throat, nose, or lungs. One spike on the virus inserts into a receptor molecule on a healthy cell membrane, allowing the virus to enter the cell. Unlike a typical flu virus, the coronavirus doesn't need to enter the host cell's nucleus. It can directly access parts of the host cell called ribosomes, which use the virus's genetic information to make viral proteins, such as the spikes on the virus's surface. A packaging structure in the host cell then carries the spikes and vesicles, which merge with the host cell's outer layer. The virus then begins to bud off from the host cell's membrane, allowing it to spread. But how does pneumonia develop as a result of the infection? To understand this, we must look at the structure of the lungs. Each lung has separate sections called lobes. Normally, as one breathes, air moves freely through the trachea, bronchioles, and finally into tiny sacs called alveoli. These airways and alveoli are flexible and springy, inflating like small balloons when one inhales and deflating when one exhales. Small blood vessels called capillaries surround the alveoli, allowing for the exchange of oxygen and carbon dioxide. In a healthy body, hair-like cilia lining the tubes constantly push mucus and germs out of the airways, where they can be expelled by coughing. However, if the immune system is weakened by the infection, the virus can overwhelm the immune cells, causing the bronchioles and alveoli to become inflamed. As the immune system attacks the multiplying viruses, inflammation can cause the alveoli to fill with fluid, making it difficult for the body to get the oxygen it needs. This can lead to pneumonia, which can cause difficulty breathing, chest pain, coughing, fever, chills, confusion, headache, muscle pain, and fatigue. In severe cases, it can also lead to respiratory failure, where a machine called a ventilator is needed to help with breathing. Now that we have a better understanding of how the virus works and how it can lead to pneumonia, let's talk about the current efforts to combat it. One of the most important methods for preventing the spread of the virus is through vaccination. The vaccine works by introducing a harmless version of the virus or a piece of the virus, such as a protein, into the body. This allows the immune system to recognize and build immunity to the virus, so that if the real virus enters the body, the immune system is able to quickly recognize and fight it off, preventing infection or reducing its severity. Scientists around the world have been working tirelessly to develop and test a vaccine for SARS-CoV-2. Several vaccines have been authorized for emergency use and have been shown to be highly effective in preventing severe illness and death caused by the virus. The vaccines are administered in multiple doses, usually 2 or 3 doses, to ensure the best level of protection. Another important method for preventing the spread of the virus is through testing. Regular testing can help identify infected individuals and prevent them from spreading the virus to others. Rapid antigen tests and PCR tests are used to detect the presence of the virus in an individual. In addition to vaccination and testing, non-pharmaceutical interventions such as wearing masks, social distancing, and practicing good hand hygiene are also effective in preventing the spread of the virus. Governments around the world have implemented various measures such as lockdowns and travel bans in order to slow the spread of the virus. The fight against SARS-CoV-2 is ongoing, and it is important for individuals to continue to follow guidelines and recommendations from health officials in order to protect themselves and others. With the ongoing efforts of scientists, healthcare workers, and government officials, we hope to see a decline in the number of cases and eventually bring an end to the pandemic.